My name is Sabrina Shea, and today we'll be talking about traumatic brain injuries. A traumatic brain injury refers to the psychological disruption of brain functioning caused by an external force, resulting in an acceleration or deceleration or a direct blow to the head. Many individuals are unaware of the most prominent ways to get a TBI. These include falls, which are most commonly cause of a TBI. Secondly, are motor vehicle accidents. According to the Encyclopedia of Neuropsychology Disorders, a TBI is the leading cause of death in people under the age of 40, and males tend to sustain more severe brain injuries. There are different types of traumatic brain injuries. There are closed and open head injuries. Open head injuries involve penetration of the scalp and skull, whereas closed head injuries occur when the head has been struck, hits an object, or when it has been shaken vigorously. Closed head injuries cause rapid brain acceleration and deceleration. Most brain injuries are the result of outside force, meaning something comes into contact with the head. There are two kinds, coup and countercoup. Coup is an injury that occurs in the brain directly under the point of impact. These injuries are present on the brain directly below the site of impact. The surface bruises, cuts, or contusions help to pinpoint the location. Lastly, countercoup. This injury occurs on the opposite side of the brain from where the impact occurred. These injuries often occur in motor vehicle rollovers or motorcycle crashes. One major risk factor associated with the TBI is the amount of time after the injury occurred before the individual seeks help needed. This can determine how extreme the outcome of the traumatic brain injury will be. The extent of disability is identified within 48 hours after the injury. According to Bigler, studies of neuropsychiatric outcome have shown the increased lifetime prevalence of depression and anxiety-based disorders in those who have sustained a TBI. Medical interventions include two scales. This is the Gaslow-Coma scale and the Rancho Los Amigos scale. The Gaslow-Coma scale is measured the injury of the alertness of the person. It is divided into different ranges from 3 to 15, 15 being awake and 3 being in a deep coma. This scale measures three things: motor, eye, and verbal response. 1 to 8 is a severe traumatic brain injury, 9 to 12 is moderate, and 13 to 15 is a mild TBI. The Rancho Los Amigos scale is also an ongoing assessment after the TBI has occurred. This evaluates 10 possible levels based on the patient's response to external information. This helps track behavioral, emotional, and cognitive changes that take place during the healing. Medical interventions include those two scales as well as x-rays and diagnostic tests such as an MRI. These give details about damage, blood clots, swelling, skull fractures, and other brain abnormalities. Client factors for a TBI. Specific mental functions. Attention. Level of distractibility increased due to cognitive dysfunction. Emotional. Patients have wide range of emotions due to alteration, personality changes, and disorientated. Memory. Memory decreased due to cognitive dysfunction. Mental functions of sequencing complex movement. They may have trouble sequencing due to memory deficit. Thought. They will struggle with logic and reasoning skills. Global mental functions, temperament and personality. Patient has lower confidence and motivation due to injury. Consciousness, state of awareness and alertness will be distorted, especially if patient was in coma state. Sleep, difficulty sleeping from being in wheelchair. Energy and drive. Patients will have a low drive and energy due to shock of injury. Sensory functions. Visual function, they may have blurred vision. Pain. Patient will have a lot of pain, dependent on severity. Vestibular functions. Certain positions and balancing may be difficult with the motor deficit. Proprioceptive functions. Changes in sensory perception is common. Neuromusculoskeletal and movement-related functions. Muscle functions. Muscle power. This may be significantly weak. Muscle tone. Muscle wasting may occur from immobility. Muscle endurance. Unable to sustain muscle contraction. Movement functions. Motor reflexes. Weak involuntary contractions. Involuntary movement reactions. They may be unable to perform postural reactions and body adjustment reactions. Control of voluntary movement. Most patients lose the ability to sustain involuntary movements. Additional functions and sensations of the cardiovascular and respiratory system. Aerobic capacity, stamina, fatigability, and physical endurance will be a struggle with the patient due to injury. Digestive, metabolic, and endocrine system functions. Lack of bowel and bladder control, and trouble speaking and swallowing. Reproductive functions. According to Claire Morey, menstrual cycle abnormalities are common in females after a TBI due to the female reproductive system being sensitive to stress. Women may also have a difficulty getting pregnant. Due to hormonal changes, there may be a decreased arousal or a change in desire. Men may have a decrease in sperm production after TBI. Motor skills. Motor deficits with various levels of functional disability, including hemiplegia, muscle weakness of the extremities, and loss of coordination of movement. Walks. Propping, shuffling, and using support in beginning stages depend on muscle spasticity. Patients may need to use assistive technology. Coordinates. Dependent on severity of TBI, can have loss of coordination of movement. Stabilizes. Loss of balance or momentarily propping will be quite common in the beginning stages of recovery. Moves. Working on strength for pushing and pulling objects, dependent on muscle spasticity. Transport. Working on multitasking with wheelchair and carrying objects, gaining strength in arms and legs depending on injury. Calibrates. Using movement of force, speed, and extent when using an object will be distorted. Paces. Maintaining a consistent and effective rate throughout an entire task will be difficult due to motor weakness of the extremities. Process skills. Attends. Patient will look away from the task interrupting progression. Paces. Maintaining a consistent and effective rate throughout an entire task will be difficult due to motor weakness of the extremities. Uses. May not be able to use tools and materials as they are intended due to memory impairment. Continues. Many skills will need to have to be relearned, therefore expect certain actions or steps to be performed with pauses or delays. Navigates. With a wheelchair, patients will learn how to use, making navigation challenging. If patients are able to walk, they will need assistance relearning that skill. Sequences. Due to cognitive deficits, this patient will seek assistance and won't be able to do repetition or remember the order for many tasks. Initiates. Again, due to cognitive deficits, it may be hard to remember the next step without hesitation. Social interactions. Produces speech. Speech dysfunction is common. Trouble forming sentences or choosing vocabulary. Touches. May be hard to adjust depending on patient's emotional effect. Empathizes. May be unable to empathize with others due to emotional negativity. Discloses. May be impulsive due to emotionally unstable. Questions. May have trouble speaking, therefore making questioning problematic. Expresses emotion. May not display emotions in a socially appropriate manner due to depression or emotional disturbances. Depression. No two people will experience the same emotions after surviving a traumatic brain injury, but almost everyone will feel frightened, anxious, or confused about what has happened. It's common for people to have very mixed feelings about their injury. Since there is an alteration in cognitive functioning, it is especially hard for patients with the TBI to remember to take their medications. In this intervention, it is recommended that the patient get in a routine. Once a week on a Sunday, the patient will fill their pillbox organizer. I would recommend the patient to use a calendar and mark off the days accounted for each week. This ensures that the patient will take their correct medicine daily. It is easy to use, prevents errors with medication, and is proactive. This intervention will promote greater health, safety, and independence to the patient. First, I will teach the patient to take their movable arm, in this case the right arm, and use it to slide the shirt up the immovable arm. Next, I will teach them to slide in their movable arm into the other sleeve. Using the movable arm, they will push it completely up into the sleeve, up to the shoulder. Once this is completed, we extend the movable arm out, ensuring both arms are in the shirt. After this step, we take the movable hand and extend the collar over the head, completing the intervention by pulling down the rest of the shirt until it fits comfortably. Individuals with a TBI can benefit from using an organizational notebook to keep important information at hand. This may include calendars, to-do lists, and journals. In this intervention, I have shown how a journal is useful when remembering a sequence of events. In this video, you can see how hard it can be for some individuals to remember what they once did before their injury. I have asked this individual to write out the steps she needs in order to complete her morning routine. Writing them out will help her memory and is a great place to store important information. Journaling can have a huge occupational impact by providing a basis for the memory to go off of. This can not only help with sequencing the day, but it can also be helpful for steps on how to do the laundry, remembering a recipe, or to remember the daily activities the individual enjoys doing.